What happened? Why did it happen? And how could it be prevented from occurring again? The root cause analysis is a process used to determine the underlying factors responsible for these adverse events. I broke mine up into 3 categories. The first is policy. Overproduction of controlled substances. Some patients receive narcotics and benzodiazepines from multiple providers, yet there is no policy standard for physicians to evaluate prescription refill patterns, nor is there sufficient oversight of whether physician prescribing patterns integrate with evidence-based guidelines. Usually it leads to undertreatment and overtreatment of pain and anxiety. Patient-initiated misconduct. Usually a pattern of unattended appointments hindered a provider's ability to meet value-based outcome requirements, and thus patients may be fired from care. In addition, complex patients with behavioral conditions can communicate in ways that result in being dismissed from a practice because of inappropriate behavior. Third is felony records and unemployment. Several patients have identified felony records and the consequential inability to obtain employment as a root cause driver of high-frequency healthcare access. Lack of employment results in limited access to insurance, so the hospital system and ED become the primary and specialty care provider. As far as clinical, usually the most common things we see is gastroparesis, sickle cell crisis pain, COPD, and palliative care or increased care for young adults. Unnecessary orders from medical doctors that keep patients days later than cleared for discharge. For the system, we have HNHC, which are often hard to find housing, transportation, access, safety, literacy, and decision makers, is a fragmentation in the design of the EMR as well.